My name is Forrest Calland, and I'm a trauma surgeon here at the University of Virginia. I'm here to talk to you about the results of your recent audit questionnaire. Your score on this questionnaire tells us about your drinking behavior and whether or not you may have a problem with alcohol. But understand, I'm not here to give you a lecture. Instead, I'd like to simply give you some feedback, discuss the pros and cons of drinking, talk to you about the available options in case you're ready to make a change with your alcohol behavior. Audit scores range between 0 and 40, with scores greater than 16 generally indicating high-risk drinking behavior. A normal score on the audit questionnaire is between 0 and 7. Your score on the audit questionnaire was greater than 16, which places you in the high-risk drinking category. I'd like for you to stop for a moment and think about what it means to you to have scored in the high-risk category. I'd also like you to ask yourself, what role, if any, do you think that drinking played in your getting injured? If alcohol was a factor in your injury, I'd like to use this teachable moment to assess your drinking. I'd like you to make a list of the pros of drinking. What do you like about it? What positive role does alcohol play in your life? I'd also like you to make a list of the cons involved with drinking. What negative things have occurred in your life because of alcohol? What would other people say are the negative things that have happened as a result of alcohol? People have a lot of different reasons why they change their drinking. Some people have serious injuries related to drinking. Others decide they can no longer afford to spend so much money on alcohol. Others see their relationships suffering as a result of the consequences of drinking. On a scale of 1 to 10, with 1 being not at all willing to be ready to change, and 10 being entirely ready to change right now, how willing are you right now to make a change in your drinking behavior? If you chose 1, have you ever tried to change your drinking in the past and found yourself unable to do so? Would you be more likely to change if you had the support of friends, family, your physician, or a support group? How would you like your drinking to look 5 years from now? If you picked between 2 and 4, why didn't you choose 1? What is it about your drinking that you would like to change? What is the best way to make that happen? If you chose between 5 and 8, then we're ready to explore some options for change. What steps do you think you could take to change your drinking? Who do you think you could ask to help you make this change? And if you chose a 9 or a 10, then we're ready to make a plan. There are steps that you can take right now to change your drinking behavior, including involving your friends and family members in your decision, changing your environment to make alcohol less available, or even removing alcohol from your home. You might even be ready to attend the meetings of a support group like Alcoholics Anonymous to help you with this decision. You can also work with your primary care provider to get the support and possibly even medication help to facilitate your decision. Because your score is in the high range, there is a strong possibility that you are currently dependent on alcohol, or more dependent than you realize. You also have a greater risk for future alcohol-related injury, so I'd like to tell you about the resources that are available to help you change your drinking behavior, as well as give you some guidelines that everyone should follow and know. Your very best resource for making this change? It's yourself. Have you ever made any big changes in the past? What personal strengths allowed you to do this? How were you successful? Friends and family can be great resources for making big personal changes, especially if they support your decisions, or in this case, if they don't drink. You may find that if you decide to change your drinking behavior, it will be difficult to stay with the same group of friends, perhaps because their drinking makes it harder for you to stay away from alcohol. Involving yourself in new activities that will introduce you to new people will help you to make new friends, and hopefully decrease the pressure that you feel to consume alcohol. Another wonderful resource is Alcoholics Anonymous. It's a free, widely available support group that has helped millions of people stop drinking. You can go to their website, www.aa.org, or call their 1-800 number at 1-800-503-8602 to help you get treatment if you feel that now is the time to stop drinking. Other nationwide resources include Al-Anon for friends and family of people with alcohol problems, or Alateen for teenagers with drinking problems or with people with drinking problems in their family and friends. Lastly, I'd like to give you some guidelines that everyone should follow. First and foremost, as everyone knows, you shouldn't drink and drive, and you should never get into a car where the driver has been drinking. If you know you're going to drink, either find a designated driver or plan to get a taxi. If you do go out and plan to drink and drive anyway, trust me that the taxi fare to get home, and possibly even the tow truck fee, will be much less expensive than paying for a lawyer to get you out of a DUI, or the hospital bill if you get in an accident and hurt yourself or hurt others. Similarly, refusing to get into a car where you know the driver has been drinking, it may cost you taxi fare, and in the worst case may cost you the friendship, but this cost is much, much less than the potential cost of a drunk driving charge or a car accident. The simple decision to not drink and drive and to not get into a car where the driver has been drinking can change the outcome of many, many lives, and not just your own. In this case, the right choice can make the difference between life and death for you and many of the people in your community. You should also not drink while driving a boat, operating heavy machinery, or swimming. It is especially important for pregnant women to abstain from alcohol, as no amount of alcohol has been found to be safe during pregnancy. And lastly, alcohol does interact with a number of different medications. If you take medications on a regular basis, you should consult with your physician to make sure that none of them interact with alcohol in a harmful way. I hope that you have found this presentation helpful and that you can take away from it some of the options available to help you change your drinking. In addition, I hope that you'll remember some of the guidelines that every person should know regarding alcohol consumption. If you have any questions, I encourage you to speak with a member of your healthcare team to discuss any of the resources that we have introduced you to today. I thank you again for taking the time to watch this presentation. I wish you a speedy recovery and encourage you again to speak with any member of the UVA trauma team if we can be of any assistance in helping you with this decision.